Hello, my name is Martina, and I am 28 years old and Aspie from the Czech Republic. Here's my issue. I've always been frightened of sex and pregnancy. I find pregnant women repulsive, and I can't even imagine being pregnant one day. I'm frightened that I will look and feel like an unappealing whale and my future husband will lose any interest in me. Everybody keeps saying, when you're ready, you'll love being pregnant, and you'll feel beautiful. But I know I just won't. My fear is so intense that if I found out I'm going to have a baby, I would rather have an abortion. I would like to have a child one day. I really like children. I am also afraid that they would never let me adopt a kid because I have Asperger's. The thought of not having children is unbearable and painful to me. Is there a way to get rid of the fear? Calucifer13 at YouTube.
Thank you, Martin. A very interesting question. Now, first of all, I think you are right that although other people may say, when you're pregnant, it will change your way of thinking, I think you will feel at the whole process. But as a psychologist, reading between the lines, what I pick up here is fear of rejection from other people, sometimes by being viewed as something about your proportions, your size, your weight. And so you're very sensitized to how people may look at your body and tease you about it. Now, first of all, what happens in Asperger's is the person may not be able to easily disclose their thoughts and feelings, but what they use to resolve anxiety is knowledge. So this is why you become larger, how it affects the body, and that this is only a temporary component. So it's really finding out as much as you can about it. And the outcome is well worth it because you have a baby. You're only pregnant for 9 months, and yet you can be a parent for about 50 years. Now, what she may have is a fear of body image, etc. Really may need cognitive behavior therapy from a psychologist to help reduce that particular fear.
Very good. Very good. Hi, Dr. Tony. I'm the mother of a 12-year-old girl who has been undergoing assessment for the last 2 years with no diagnosis. Her ADOS and Gilbert came back inconclusive. Whenever I mention to other workers about the need for a diagnosis, I am treated like a neurotic mother. I've been told that a diagnosis won't make any difference. My daughter will still be my daughter. However, she dropped out of school a month after starting comprehensive. I'm upset with the school for not recognizing or understanding her difficulty in coping. I feel my daughter will need a diagnosis to help her understand herself. She already knows she's different from her peers, and she started to ask why. Am I being a neurotic mother, or is a diagnosis really important? This is Andrea Mason at YouTube.
First of all, a diagnosis is extremely important. We tend to find that classic autism is diagnosed in the preschool years. Asperger's in boys in elementary, but girls tend to be at the high school age. And that's what this girl is now going through, because the girls are better at camouflaging their social difficulties. In other words, the girl is very good at hiding being different. Now, the next thing is the ADOS and the Gilbert criteria are really standardized on the boy's expression, not the girl's expression. So I wouldn't necessarily use those as the ultimate instruments for a diagnostic assessment. Now, will it make a difference? Yes, it will, because she's 12 years old and she's starting to realize that she is different, and the psychological consequences can be depression, can also be anger with the world, a whole range of things that may start to occur. So what they do need is a diagnostic assessment by someone who is experienced in girls and women. Now, this person is in the United Kingdom, and Dr. Judith Gould has specialized in girls and women with Asperger's syndrome, and she may be able to recommend someone who could help in that area. Go ahead and do what you can and seek that diagnostic assessment.
Question number 6. Does Asperger's with a seemingly genetic component appear to pick up momentum through each generation? Should future generations in a family be made aware just as much as with any other type of genetic disorder or condition? We are undiagnosed, but there is a family pattern, and I'm concerned for the next generations not having an understanding of ASD. This is Dazzle at Autism Hangout.
Okay, first of all, yes, the geneticists say that certain characteristics can become greater through the generations. But it's also a question of who do you have as your partner? Sometimes there's a sort of an attraction, Aspie to Aspie, but also extreme neurotypical to Aspie. And that extreme neurotypical may have in their family history Asperger syndrome. So you've got two families combining, and like breeding dogs, those characteristics will be accentuated. You'll have more extreme neurotypicals and more Aspies. So yes, it is a characteristic. Now the thing is, if it is increasing through generations, what would you do if you're a couple and the geneticist could say there's a strong probability your child will have an autism spectrum disorder? What are you going to do about that? Because if we eliminated, in a sort of racial cleansing, those with Asperger's, we would lose Mozart and Bill Gates and Einstein and all those sorts of people. Mm-hmm. So what may help is it's better to understand the individual, but not to, shall we say, remove that from the human gene pool. Mm-hmm. So yes, I agree. I have found families where it seems to get greater through the generations. However, today we are more sensitive. And what happened years ago was that you could create an isolated lifestyle. You could be in a monastery, for example, mm-hmm. or at school, you just sat at a desk and learned. You didn't work as a group, and there wasn't the concept of the team. So I think in days gone by, Aspies were there.
Yeah, they were less apparent. The next question is about meltdowns. I have a question regarding meltdowns. Sometimes when I suffer from sensory overload, I go into kind of a trance, similar to a computer freezing when too many windows are open. I lose my ability to speak. I have severe difficulties understanding speech. My vision is fuzzy, I feel dizzy, and sometimes sick. I also lose orientation. I can't take anything in, and I'm lost in my own world, and noise and light is even more unbearable than before. Is this a meltdown caused by sensory overload, or is it something else? This is Aspinaut at Autism Hangout.
Yeah, it sounds like it's an overload from sensory experience, and basically your brain has blown a fuse. The thing is, you've got to get out of those situations as fast as you can, and often by reducing sensory experience and solitude, the person can slowly recover. Now, there's an excellent book called From Anxiety to Meltdown by Deborah Lipsky. She describes what happens with a meltdown, with the huge sensory overload. Now, what you try and do is identify those situations where you're likely to experience overload, or internally being aware that your sensory system is becoming overwhelmed by what's happening, and either avoid the situation or try and take your mind off this by some distraction. Some will use a computer game, but I also strongly recommend that you explain to people that you are overwhelmed by the sensory experience, and for a moment take a deep breath and try and reduce the sensory experience. Mm-hmm. So it sounds very much like a meltdown.
Mm-hmm.